Hi, I'm Dan Bush, the chair of the Fed Up Coalition, and I'd like to welcome you to our webinar on how advocates are fighting back against misuse and supplantation of opioid settlement funds. Next slide. I'd particularly like to thank the following organizations for making today possible: KFF Health News, the Valoma Foundation, Southeast Florida Recovery Advocates, James Place, the National Sea Change Coalition, and the Opioid Education Foundation of America, which is producing this webinar. Next slide. Fed Up was formed in 2012 by parents from across the country who had lost children to opioid overdoses and came together determined to do everything they could to bring the opioid epidemic to an end. Next slide. Opioid lawsuits were settled for approximately $55 billion, and 85% of that money must be spent on opioid remediation. For purposes of this webinar, I'm going to be using the terms opioid settlement funds, opioid abatement funds, and opioid remediation funds equivalently. Opioid settlement funds have special meaning to those who lost loved ones due to the opioid epidemic, which led Fed Up to a campaign to make every penny count, and you can see our logo for that below. We encourage Fed Up members to get involved, to advocate for best uses of opioid settlement funds. At the time, we didn't anticipate supplantation or misuse. Next slide. So opioid settlement funds should be used to supplement existing funding for opioid abatement. Supplantation occurs when opioid settlement funds replace an existing funding stream that has been paying for an opioid abatement program. The supplanted funding stream can then be used however the government wants. Strangely, supplantation is allowed under the opioid settlement agreement. Only 13 states and DC have rules of any kind against supplantation. Misuse occurs when opioid settlement funds are used for purposes not associated with opioid abatement. Next slide. John Oliver pointed out that supplantation really is misuse, which is hidden by an accounting trick. Alexandria, Indiana used opioid settlement funds to pay for box lunches for municipal employees during the solar eclipse. That's clearly misuse. If Alexandria had used the very same opioid settlement funds to pay for the town's existing MAT program and then used the freed up money to pay for box lunches, it would have been supplantation. So whether it's called misuse or supplantation, these funds are no longer available to provide additional opioid abatement programming. Next slide. This is a new slide from Christine Minhey, who determined that over 70% of opioid settlement funds can legally be spent on supplantation. That doesn't mean they are, but it means it's really about the threat we have of the use of funds being used for supplantation. Next slide. So we weren't expecting misuse or supplantation, but we were wrong. Aneri Patani, our first speaker, reported supplantation in Indiana and Pennsylvania. Susan Osterman, our second speaker, found that local government supplantation was common in Pennsylvania from the get-go. Our third speaker, Maureen Killian, was chair of the Palm Beach County Substance Use Advisory Board when the county responded to new state laws by trying to take money from opioid settlement funds. And our fourth speaker, Barbara Allen, struggled against Maryland's decision to take $1.5 million from its opioid restitution fund annually to fund future lawsuits, and then took millions more to help balance the state budget. Next slide. But the most shocking misuse of all occurred in Arizona, which moved $115 million from opioid settlement funds to the Department of Corrections to help to balance the state budget. That's more than 10% of the opioid settlement funds that Arizona would receive over the 18 years of the settlement. Next slide. In 2025, more than ever, we need effective advocacy regarding opioid settlement funds. COVID-era funding is coming to an end. There are major cutbacks in federal funding. The states are short of money, and as reported by Aneri Patani, as federal funding dries up, states turn to opioid settlement money. 3 states with no supplantation language have even shown interest in reversing themselves. Next slide. Today, we'll be hearing from people who've struggled with governments taking money set aside to abate the damage done by the opioid epidemic. I've mentioned Susan Osterman, Maureen Killian, and Barbara Allen. Our final speaker will be Elizabeth Burke-Beatty of the National Sea Change Coalition. She's demonstrated creative leadership in helping to build coalitions to exercise greater political power in the effort to make best uses of opioid settlement funds. And with that, I'd like to turn things over to Aneri Patani of KFF Health News.
Thank you, Dan, and thanks everyone for joining today. As Dan mentioned, I'm a reporter with KFF Health News. We are a national nonprofit outlet, and I have been working on a series of articles about how state and local governments are spending their opioid settlement money for a little over 2 years now. Next slide, please. You can actually go one more. And so this is everything that I will share with you today, going in a little bit more into depth, and some of the stuff Dan mentioned comes from this reporting project. And so most of the databases I mentioned or the articles you can find here, which is kffhealthnews.org/opioid settlements, and a lot more that I won't have time to get into today. Next slide, please. So just to refresh what Dan said, the opioid settlements are coming from lots of different companies over different timelines. This sort of breaks it down. It's from Christine Minhey, who runs opioidsettlementtracker.com. But you can kind of see there's a lot of different companies, which means there are different legal agreements with each of these companies with the state AGs. But big picture is that we're looking at about 50 billion total coming over a long time period, 18 years in some cases. Next slide, please. So because there are all these different agreements with different companies, the requirements kind of vary between some of them. But big picture, for some of the largest settlements, there's this requirement that every state spend at least 85% of their funds for what is called opioid remediation. In layman's terms, I think that basically means things related to the opioid crisis. And then it includes a list of suggested uses that would fall under opioid remediation. So we can see these on the next slide. So these lists of uses are in what's called Exhibit E. It has over 100 suggestions of things that could qualify as opioid remediation. And it is non-exhaustive. So places are encouraged to do things that are on this list, but states can also spend their money legally on things that are not on this list, as long as they can tie it back to opioid remediation and meet that 85% threshold. Next slide, please. But as Dan mentioned, the national agreements really don't address supplantation. Exhibit E doesn't talk about it. The agreements themselves don't really talk about it. So it has been up to state and local governments to say whether that is something they will allow or not. The majority of states allow it. As you can see here, every state that's dark blue allows supplantation. There are only 13 states in Washington, D.C. that have some sort of restriction against that. And those restrictions vary. In some cases, it's, the state, when it created a memorandum first establishing the opioid settlement agreements, that memorandum of understanding has some language in there about not allowing supplantation. In other states, places passed laws against supplanting, but it's still a minority of places that have some sort of restriction. Next slide, please. So when I started reporting on this issue, I felt like this quote really captured why I was hearing folks were worried about supplanting. And it's that idea that the spirit of the settlements wasn't to keep doing what you were doing. It was to do more. So supplanting is technically legal in many places, not all. But what that means is a local government would continue funding the level of programs and services to address addiction and overdose that they were already doing. And a lot of the advocates I spoke with for articles said, what we were already doing was not enough. People are dying daily, tens of thousands of people a year. And so with the opioid settlement money coming in, we want to be able to add on top of that, increase what we're doing so that we have better outcomes, so that fewer people are dying. And I just thought Robert Kent kind of encapsulated that in his one quote. Next slide, please. So this was the first article that I had reported on the issue of supplanting. This is a little over a year ago now. And I just want to detail some of the examples that we found at that time, so you have an idea of what this can look like. So in Scott County, Indiana, the local county government spent a little more than $50,000 on of opioid settlements on the salary for its health director and for emergency medical services staff. And then they took the money that, of course, they already, had been paying the salary of these folks with normal county funds. They kind of took that money out and moved it over so that they could buy an ambulance and then they could create sort of a rainy day fund for their health department. So it saved them money from the general fund by substituting opioid settlement dollars instead. Similarly, in Blair County, Pennsylvania, the county government spent about $320,000 in opioid settlement funds for a drug court that had been longstanding, had been operating for years and years, which means it already had a funding stream from the county's budget. But the county saw an opportunity to kind of take that but normally budgeted money, move it to something else, and use the opioid settlement funds instead. And then in Bucks County, Pennsylvania, this was sort of a slightly different example, but several, policy experts said to me that this seemed like supplantation to them as well. The county had an opportunity or had received a federal award and they had money left in that award to spend. They did not spend it in time, which means $1 million went back to the federal government. And then the county still wanted to build this behavioral health crisis stabilization center. So even after forfeiting the federal money, they just turned to opioid settlement funds to help do that instead. And so these were several examples that we were able to report out and kind of see what supplanting looks like in real time. Next slide, please. This is the article that Dan mentioned more recently. So just from February earlier of this year, I've been hearing more and more since then that as the federal government is cutting grant awards, cutting staff, there's less money coming from SAMHSA, potential cuts to Medicaid or block grant programs. There's a lot of stuff on the table, which means state budgets are looking really, really tight, and they're looking for ways to fill the gaps and plug holes. And there are a bunch of states that have said, maybe we need to turn to the opioid settlement funds to make up this difference. And there's been a lot of conflicting views on this. I think some advocates really feel like that is not what the settlement money was made for. Again, going back to that quote about the spirit was to do more. And there are also people who are saying, well, with such severe cuts, if we're going to lose the existing addiction services, at least we can keep them afloat with the opioid settlement money. So I am kind of looking at this moving forward, imagining this is going to get become more and more of the center discussion around settlement funds. Next slide, please. So the last thing I want to share with you all is just that if you're kind of trying to find how your state or county government is using this money and see if they might be supplanting with it, us at KFF Health News, along with folks at Johns Hopkins and Shatterproof, have created a database to track how this money is being used. This was published at the end of last year to show spending in 2022 and 2023. We will be publishing another version of this database showing spending from 2024 later this year. So those are resources. Next slide, please. And that's it. Just I'm happy to share that information with you all and happy to chat more during the Q&A. And I'll hand it over to Susan, or back to Dan, rather.
Thanks, Aneri. That was great. I'm going to pass things on now to Susan Osterman from the Viloma Foundation. Susan.
Good afternoon, everyone. I'm Susan Osterman. I'm the founder and executive director of the Viloma Foundation, and we provide peer grief support for families of loss. I lost my son Tyler in 2020 to a fentanyl, heroin, and xylazine overdose. But what took him wasn't the drugs. I call it a cascade of systemic failures. Since then, I've been advocating for this money to be spent properly on programs that are rooted in evidence and science and research. For me personally, my county first formed an opioid settlement advisory committee that didn't include anyone with lived experience, living experience, or any victims at all. So a friend, another brave parent, advocated to have someone put on the county committee, and it was me. In attending these meetings, it was clear that we weren't going to be heard. I was the only one who asked questions. I was the only one who had a conflict with them investing the funds in the programs they had already been using for years. So when the vote came later that year, I voted against the plan that they were proposing, and then I wasn't invited back to any more meetings. Didn't even know they were having them. So I began doing my own research and looking into what other states and counties were doing. And we sent a letter to our governor in February and received no response until Iniri published it on KFF News and reached out to them for comment. And since then, we now have met with our governor's office to discuss the issues with supplantation. And sorry, let me back up. One of the examples in my county is they used funds to purchase naloxone directly from the manufacturer when they can get naloxone for free from the state. They're using it to invest in programs that are already grant funded, lots of supplantation going on. And when I asked the chair of the state commission about it, he said, well, supplantation's allowed. There's nothing we can do about it. They really didn't seem to care. As victims, no one was looking to be compensated, even though, in this country, COVID funerals, everybody received a $9,000 funeral reimbursement, but families of this epidemic have received nothing. None of this money goes to victims. And that's fine, as long as it's being spent on programs that work. Unfortunately, we're not seeing that. So back to what we did, we sent the letter, and we've now been meeting with the governor's office, and they're allowing us to edit the supplantation, or I'm so sorry, edit the subdivision agreement in Pennsylvania so we can put people with lived and living experience in the oversight committee. Hopefully, I mean, it's still early, but we'll see. I have a lot of hope that that will work and we will be able to have our voices heard. There's too many counties still allocating funds without the voices of victims or people who have been directly impacted. A lot of the money is going to law enforcement, administrative overhead, abstinence-only programs that have now been shown to increase the likelihood of a fatal overdose than no treatment at all. Pain patients are being further harmed. They're cut off from their medications. I mean, these are regulatory failures. And to have the money be put in the hands of politicians and government officials who truly are at the root of the problem is a real mistake. And I'm not here to promote any one solution. I'm here to insist that solutions are grounded in what works and not what's convenient or politically palatable. This crisis was never about bad people making bad choices. It's about pain, disconnection, and greed. Excuse me. And that's really all I have to say. I thank you for allowing me to speak, and I appreciate all of you.
Thanks, Susan. I appreciate your talk and also the work that you've done. It sounds like you've made some real progress with the governor's office, which is great. I'm going to turn things over at this point to Maureen Killian from the Southeast Florida Recovery Advocates.
Thanks, Dan. I'm Maureen Killian, and I'm the leader of Southeast Florida Recovery Advocates, whose mission and vision is to assemble a forum through which education, prevention, treatment, and recovery advocacy groups align, working towards common objectives surrounding all aspects of recovery from substance use and related disorders. Next slide. I have some contact information there, and you can see how we've developed, we've taken individual organization and become like the umbrella for Port St. Lucie, Martin, Palm Beach, Broward, and Miami-Dade counties. Next slide. In the state of Florida, we do not have any legislation to prevent supplantation at this time. We do have MOUs. And so therefore it is up to us, the recovery advocacy community, to ensure that the MOUs are followed and that we severely mitigate the supplantation stretches. Next slide. An 18-member committee was formed by Palm Beach County, County Administration, an advisory board. And during our meetings over quite a few years, because we've been in existence or started formulating a plan back in 2019, but our biggest movement was that 90% of the opioid monies going in Palm Beach County are used for the social determinants of health, such as housing, recovery support, job training, youth assistance, and prevention. And 10% would go to the acute care, the system that many committee members blame for treating their loved ones and putting them back out on the street, you know, the infamous treat and street. We've rallied significantly throughout Palm Beach County and Broward County, Miami-Dade County. And the emphasis on our 18-member advisory board committee is that it's really important to us because there's so many people who have participated as members of our advisory board, or formerly known as the steering committee, who are no longer with us today. And they're not here because of the failures that we know are there, the systemic barriers. So we're here, we graciously accepted the charge from Palm Beach County Board of County Commissioners to reverse the exact failures that we see as boots on the ground. Next slide. So the 90% to 10% was a little bit tenuous because we still need, you know, the acute care, but we do have in Palm Beach County, we have St. Mary's stepping up to the plate with the healthcare district, the county in that support, and of course our managing entities. So that is where those other dollars are being used, and want to preserve the opioid settlement dollars for people who have been harmed and people who are on the street every day seeing the failures. Next slide. So here's the social determinants of health. Many know these, many don't, but the moment a person is discharged from an acute level, there's so many services that are needed: a license, a social security card, transportation, housing, food insecurities, jobs, showers, clothes. That's where we want to, you know, enhance the system of recovery. Next slide. Fortunately for us, I believe that our Palm Beach County Medical Society, which is our organization of physicians in Palm Beach County, we have a really, really strong leader who supported our efforts and is actually on the advisory board and has done and produced many continuing education credits about the opioid epidemic, including harm reduction, including physicians and medical professionals that get addicted, and how to reach for help. And that to me was really powerful in Palm Beach County when they hear from the physician community and not just the stigmatized person who's suffering from substance use and can't access the services that they believe are accessible. Next slide. The other big kudos for us in Palm Beach County to prevent some supplantation is that our Board of County Commissioners is very, very involved. Began with Melissa McKinley, former mayor and commissioner of Palm Beach County, who started and gave us this privilege. But after we presented, you know, everybody spoke up. The county administrator, she lives it. Mayor Sachs, I just want to say that I've never been to a county commission meeting ever that was so heartfelt. I don't think there's a family that has not been affected by this scourge. So they are really listening to the community. And again, our 18-member advisory board is made up with people with lived experience, parents of loss, parents of kids who are loved ones who are in active addiction. We have law enforcement, we have the healthcare committee, we got Palm Beach County Medical Society. So we have a really rounded committee to propose how these settlement dollars should be used in Palm Beach County. Next slide. While other communities have been criticized for misspending the proceeds from the class action lawsuit against pharmaceutical companies, We, again, have spent 2 years here developing a person-centered approach. Again, that's aimed at the getting rid of treat and street. Because we've had multiple cases of people being in our addiction stabilization unit and acute care and going to the parking lot and overdosing and dying right there because there are no services, there were no transportation, there was no follow-up. Next slide. The language we adopted was first issued by the Fed Up Committee, and we adopted this language regarding supplementation. Opioid settlement funds shall be supplemental to and shall not supplant or take the place of any other funds, including but not limited to insurance benefits or local, state, and federal funding that would otherwise have been expended for such purposes. Funding shall be used exclusively to fund the programs or projects that align with the goals of our 2024 plan. So we don't have a law in Florida. We adopted a language of recommendation to the Board of County Commissioners, thanks to the Fed Up group that promoted this supplementation language. Next slide. We recently met, we sent out our NOFO, and we had applications. There's a few bugs in all of that. And monies have been awarded. There's still $1.6 to $1.7 million that have not been spent. And the county has assured us, next slide, that we will actually have another opportunity for boots on the ground folks to apply who don't have the privilege of paying a grant writer. So we're looking forward to getting some monies into the organizations that are on the streets every day. Next slide. And again, there's a little disappointment in the committee. We promised that this time it's going to be different, and this time it wasn't different. Chairperson Ray, a pastor, now we have to go back and say, let's work a little bit harder, because we, over the years, repeatedly have said, we're not going to keep doing the same thing over and over. If what we're doing is working, then we won't be here today. So we're still advocating and we're still watching. Next slide. And this is my why. My son is in recovery today. And I've been advocating since 2009. Quite a long time. And this was a little letter that he wrote to me at one of our rallies in Boca back in 2018. So I'm here and I keep doing this. And I think Palm Beach County, thanks to our supportive Palm Beach County Board of County Commissioners, we will move forward and preserve every dollar spent, and that those dollars are meaningful. And you hear the word blood money, and it is pain and suffering, and they have to be used correctly. And the people making these decisions have to listen to the people on the grounds, the people who have experienced the pain and the suffering and the loss. Thank you. I'll turn it back to Dan.
Thank you, Maureen. I mean, I really liked your point that in the absence of anti-supplantation legislation, it's up to us, it's up to people in the recovery advocacy community, as you put it, in order to do as much as we can to get people to use this money appropriately. So thank you. Our next speaker is Barbara Allen from James Place. Barbara, I'm turning it over to you.
All right, thanks, Dan, and thanks everybody else, but thank you all for being here. James Place, we're a nonprofit. We provide funding for folks transitioning from treatment into recovery housing, which, as you all know, not so much. And we also do the policy advocacy. That's really the main thrust of what I do. And next slide, please. Many of us have a story, and I've lost my son, 2 brothers, and a niece, and that's my why, if you will. But when I gave my son's eulogy, it never occurred to me what I would be doing 20 years later. I had no idea. I understood because of the losses we've had of some of the, on that side of the world, but I didn't really know anything about the other side, the advocacy, the laws, blah, blah, blah. So I realized that I had a story, but I didn't really have a purpose. And I began doing research, and the more I learned, the more foolish I felt, the more ignorant I felt. But if there's one thing I can leave you with today, it's advocacy works. Just don't do it alone. This is not for the faint of heart. And quite honestly, the last thing you want when you're doing an advocacy testimony or what have you, you do not want somebody, whether it's a legislative person or it's an elected official or it's a reporter, asking you a question and you have no idea what's going on. You don't have to know the answer, but you need to understand that that plays into the whole picture. I've met thousands of bereaved parents and siblings and grandparents over the years, and I've met equally thousands of people in recovery. And we seem to forget that people do recover. So supplantation to me is due to the stigma and greed which has taken the lives of our loved ones. Stigma is a horrible cause of death. And for me, these funds are very, very simple. It's to save lives. That's it. It's that simple. Next slide, please. This slide I'm not going to go over because my point here is, and you'll see that if you want the slides, start here. There's a lot of information to go through to understand why it's complicated and why it's not just why don't they do just this or just that. Next slide, please. All right, in Maryland specifically, that's where I'm at. The money is allocated in this way. It's all allocated towards opioid restitution fund, ORF in our state, 30% for the state, 15% of which is supposed to be for RCOs. Good luck with that. 45% for grants, 25% directly to subdivisions. We are a no supplantation state, but there is a gotcha there. And at the time that this was put into play, the ORF commission was put into place, they haven't been very effective. This is the statewide. They have not been very effective for political reasons and a lot of transitions. Locally here in Howard County, we qualified for 70% directly due to other efforts that we had already been doing here in the county, particularly the Opioid Collaborative Community Council. This is something I helped start in 2018. It was made up of everybody: police, fire and rescue, school systems, bereaved parents, those people in recovery. We have a great Korean community, Black, gay, you name it. They served on this for 6 years. Because of Fed Up, I was very aware that this was coming, and I wanted to do the best I could to educate everybody in our jurisdiction. We sunsetted last year, and now we got approval for a permanent commission, the ORF commission, which we're in the process of putting in place today. Next slide, please. All right, so just examples of this year, we had a deadly deficit, the $3 billion deficit for our budget. Our legislators legislate, anyway, that the people who make those laws, they meet from mid-January to mid-April. And we started that in that, down that nightmare. Because we are no supplantation state, our Attorney General and the legislature invoked what's called the BRFA, B-R-F-A, the Budget Reconciliation and Financing Act. And essentially what this does for what we're dealing with is it allows the legislators or others to take existing funds like grants, like ORF, and use it wherever they would like to use it due to the financial crisis. So these are some examples of what we faced this year. Actually, our Attorney General asked for $1.5 million to fund his unit, the ORF unit that had been existing for 6 years. We fought it. We didn't win completely, but instead of being funded forever, we did get a restriction, a concession of 4 years. And we finally got mandatory reports from the AG, even though it's in the national, the one that the state signed and one that the jurisdiction signed. The other one was a $7.4 million for our Behavioral Health Administration and Department of Corrections and others. And we couldn't get concessions on this one. However, since the funding was to provide MAT behind the walls in the state facilities and other programs that support what we're about for the opioid restitution fund monies, we didn't go to battle for it. Let's see. I don't know where, I can't see the bottom line. So I'll go to the next slide, please, Greg. Okay, so how do we do it? We don't have the overarching organization that some states have, and I'm green with envy. However, we have these various coalitions: behavioral health, children's behavioral health, parity coalition. We deal with parity issues in ATAC. And my shout out to all of my friends here from these organizations. Collectively, we've taken bites out of the issues, depending on what they were, including, the parity laws are a big one. But by having all these different advocates in these different positions, we've been able to blanket the state and within the jurisdictional areas to face and work on seeing that the appropriate laws are passed, appropriate budgets are passed, and it gets really, really, really complicated. But together we're better. That's the best thing I can tell you. So next page, please. Okay, one thing I wanted to add is that you never stop paying attention. In that, just recently, I discovered that our county executive here in our county, our OCCC, we were in charge of deciding how the money went, or if monies were spent. I just found out that our county exec took $900,000 and is giving it to a local hospital. We've gotten zero from that hospital in services and support. So we are working very diligently. I have meetings set up to say, look, if this is how it's going to play out, we want something in writing of what we're going to get back for it. We want proof in the pudding. So that's where I'm at. Thank you all for being here. And I want to thank everybody for doing what you do, whether you're a speaker today or if you are out there in the public watching, and have a great rest of the day.
Barbara, thank you. I think the thing I've taken away from what you two were just saying is not only the tremendous personal work that you've done, but the work that you've done in building coalitions, and what a tough fight it is additionally. I'm going to turn things over now to Elizabeth Burke-Beatty, the founder and president of the Sea Change Coalition.
Thank you, Dan. Thank you, everyone, for being here. It certainly is a privilege to be with the folks that are speaking today, and I am really honored and privileged to be able to be in this work. My name is Elizabeth. I'm the founder and president of Sea Change, and I'd like to just start out quickly by saying that I'm not going to talk about New Jersey, where I live. I'm going to sort of take a larger stance here and a broader stance to sort of leave you with ideas about how you can get started. My guess is that we have, last count, we had over 27 different states represented in our guests today on this call. And I get this question a lot, like, where do I start? What can I do? So I'm going to just tell you briefly what my story is. I am a person who is in recovery, self-directed recovery, and I own that, and I'm proud of that, and I wear that like a badge of honor. I am also a family member who has lost loved ones to this crisis. I have done my fair share of grieving and holding up other people who have had to grieve many, many deaths. I'm also an outreach worker. I'm a harm reductionist. And I just want to express that all of us, faith leaders, community health advocates, parents, brothers, sisters, like you and me, we are the change, right? We really are. And my start really happened in this field when I found recovery. I immediately started giving back. But what I learned and what I carry to this day is that we're better together than alone. Nothing about us without us. So as a Superstorm Sandy survivor and a person in recovery, obviously, I lost everything, was displaced. I started a survivors support group for that. What I realized was that I started seeing this heightened substance use as a tool to cope with the trauma. And that was not new to me. However, it was new to my neighbors. And I just became a very kind of go-to person in my neighborhood, in my community. And then the overdose crisis, you know, was starting to be front and center, and we were losing people left and right, and that was very upsetting. So just as one person, I took it upon myself to say, like, this deserves attention, right? And what I want to also say to everyone here, like, you are and can be a creative catalyst for change. That's how I consider myself, right? So long story short, fast forward, I decided to set up a recovery community organization. Yes, it takes work, it's hard work, but it's doable. The passion is not, you can't teach the passion, you can't teach what it's like to have these losses, but they can be that catalyst for the drive to make change. And that's what I had, and that's what I do have. And so not wanting to do things alone, I then realized, you know, just being an RCO, not that that's not great, that's great. But being an RCO isn't going to be enough, right? If we're really going to get in this fight and like try to make a change on a legislative level. So I'll also preface, I'm not following my slides. My slides are going to be for you to refer to after this talk ends, as ways you can get yourself involved. So there was C Change RCO, and then there was a community organizing group, or a existing coalition, right? So there's this group of people that are in recovery, or are trying to find recovery on their own terms, including harm reduction. And then we have community organizers. And I went to those organizers, and together we decided to form what we call the Not One More campaign for New Jersey, which is a statewide campaign to end overdose. And then, so I'm not in that's their expertise, community organizing. We have expertise in like running an RCO that also became the first harm reduction center. So I'm also a big believer, like what you need can be created. So when I first started doing all this work, they said, you can't be both. You can't be an RCO, you can't be a harm reduction center at the same time. And I don't agree with that. And so we proved them wrong. And we went to the organizers, and then we started building power. So what I'm going to say is, you can start as one person with a fire under your butt, right? And then you can find the groups and the community members. And then as a group, you can go to your council meetings, you can go to your state meetings. And if you go as an organized group together, you're going to get farther faster. And so that's what we did in New Jersey, right? So we have this Not One More. The people in recovery, the drug users, inform the organizers, the organizers, community organizers or advocates. They teach the folks who are either in recovery, like, you can build recovery capital by taking action, and we'll teach you how to do that, how to tell your story, how to talk to legislators, how to go to these council meetings and speak up. And we've been able to make a lot of great change in New Jersey by doing this one step at a time. It's remind yourself to ask better questions. Just do not accept things the way they are. You don't have to reinvent the wheel, but you can get together and share the load. Try new things, fail forward, start small, think big. So what happened was, when we made this creative model, I'll call it a creative model, catalyst for change, right? Which is, organizers, advocates working and with people in recovery and people that use drugs and family members, then became a model that other people have interest in. So then we became a national sea change, meaning we are working with other states in rural communities specifically, because we're in a rural part of New Jersey. We are working with them to help them do the same idea in a way that works for them. So then once you create that power together, you set your own agenda. We need a resource center. We need a harm reduction mobile unit, whatever it is you need or want, right? and then you strategize, work hard, go to the people that are managing these funds, demand answers, and offer solutions, right? And so what we've done nationally and both statewide in New Jersey as a collective, we've come up with the roadmap for opioid settlement funding. So if we find a county that hasn't spent any money at all, or a municipality, we have a roadmap that says, and you can go to the next slide, please. I just want to show everyone. This is us organizing this slide. Okay, so what you can do, and I offer this just as another tool. Here are a lot of the main resources that were discussed today in terms of where the money's being spent. And you've heard from, you've heard a lot of details, which are great. And you can find all of those here. But the national roadmap for opioid settlement funding then came from more people coming together, which I was part of a group. We had a meeting in New York City, and we all said we all care about this issue. Let's not leave the meeting without an action. So we wrote this national roadmap for opioid settlement funding. So it basically tells your legislators and your decision makers, this is how you can spend the money. These are evidence-based ways that work, that we believe in. So then we took that roadmap back to New Jersey and we customized it. We took what we wanted and what we need for New Jersey as opposed to this national effort, and we customized, and now we're using that roadmap to help train other towns, other communities, how they can get organized around what they need and what they want and how they can ask for it and how they can achieve it. And that's so I started really small, right? Lead by example. If there's something that needs to be done, if you see a niche that needs to be filled, start working on it. There are lots of people that will help you, including National Sea Change. If you need help in your area, if you're at a loss, between all of the experts here and our help, we can help you kind of figure out how to move forward. But don't think that it can't happen. Because I had a coach tell me once, if you think you can, or if you think you can't, you're right. So I'm just the person to tell you, I think you can, I think I can, I know I can, and it's happening. So do not be afraid to be that person who makes the beginning ripple of a giant wave, right? So that's sort of a pep talk, but it's also, I want everyone to understand that there are doable, achievable steps, SMART goals, etc. But if you have the passion, and if you are devoted to this, and you do not want to see supplantation or misuse, now is the time to be involved with people like us, all of us here. There's no need for us to do it alone. We need to collaborate boldly, very boldly. We need to make sure that our tables that we create are diverse, that we're listening to each other, that no one is the one all be all expert, but that we can actually use this money for good and for real change. And if we don't keep working on it now, it will bite us in the butt, just like the tobacco settlements did. But anyway, thank you for your time.
Elizabeth, thank you so much for that wonderful presentation, which emphasizes both your own personal story and also provides a kind of roadmap for how people can move along in terms of developing their own skills as an advocate and bringing in other people. So thank you. We're going to turn at this point to some questions and try to get some answers to those. So maybe I can get the whole panel up here. Some of the questions have been about the impact of losing federal funding. And at that point, what happens in terms of the issues of supplantation? If there's been something that's been funded previously, by money from the federal government, and that money is now gone. Is it supplantation to be using money from opioid settlement funds? Anybody want to take a crack at that?
I can give a quick response, which is just from my reporting and talking to folks, it really depends who you ask. I think there are some people who feel that, yeah, if there was a great program that was shown to be successful, that was being used, and now it is in danger of closing because there is federal funding has been pulled, then I've heard from folks who support using opioid settlement funds to continue that program. On the other hand, there are folks who feel like that's a slippery slope, and you do kind of get into the area of supplanting if we say, anything that was existing, we just want to sustain with opioid settlement funds. And one point that I made in the chat, someone had mentioned this as well. The settlement funds, while there are a lot of them and it's important, it's a big influx of money, it's not enough to cover all the different federal funding cuts that are happening. So even if they are plugged into those holes, there will still be holes that exist. It cannot cover them.
Yeah, just to elaborate on that, I think that one of the reasons that we really need to make sure that this money is used for, for opioid abatement is the fact that there are so many cutbacks that we don't want it to see it go to other things entirely that have nothing to do with opioids. We need all the money we can at this point for things that have to do with opioid programming.
Can I add something? I think it's also really important, we're seeing some in our state, some counties being very transparent and open and others not at all. And to really make an effort to hold them accountable for being more transparent, because once you dig and get those answers, we're finding that people are, the people that are misusing and supplanting are counting on us not doing that, so that they can buy wrapped vehicles and things like that that have nothing to do with the opioid crisis.
I just finished that up, Elizabeth. What you said too is that's why I encourage people to ask, look for reports, get what you can in your states. The data may not be very obvious, but there are ways to get the information. So just keep asking questions. Be obnoxious, that's fine. Be bold, I think you said, Elizabeth. In Maryland right now, letters are going out from the governor, as an example, to folks saying we're looking at some potential issues financially. So we're talking about a voluntary separation agreement. We don't know what that means yet. So just wanted to give you a heads up, and that's going out to employees of the state. So I know our legislature will be reconvening once we have a better idea of what's actually going to happen.
Also use right to know requests in your state and FOIAs to request the information. This is public. This should be publicly available to everyone.
Yeah, thanks for making that point, Susan. That one of the organizations that was listed at the end of Elizabeth's slide set, Muckrock, has forms that can help you get the Freedom of Information Act requests out. Can we move on to another question? Someone asking about how any of these rules are enforced about what % of money is going to go to opioid remediation. I'd like to say something about that, which is that the states really have tremendous power with this. There's the only people who could really sue the states for not using this money properly would be the ones would be the defendants in the lawsuits. And the result of that is that you get states where they're going to use the money the way they want. And it's kind of shocking to see how they've done that. States have altered some of the settlement language in their memoranda of understanding. In Florida, it's not about opioid use disorder, it's about substance use disorder. Ohio and West Virginia both include giving money to police for policing operations in their MOU. And if your state attorney general decides that what the state is doing is okay, the state can just do it. So that's where all the advocacy we're talking about becomes extremely important, just in order to try to move public officials in a direction that they're going to do things that will keep this money for opioid remediation. Anyone else?
I would just like to say it's 24/7 vigilance. You know, because every legislative year there's new laws, there's new changes, and there's unintended consequences in many of those. Like in it, for example, in Florida with the housing, you know, initiative, we got some top-down input when our plan is bottom up. And as much as I want everyone to have a home and a safe place to stay, the county, if the county uses those funds, our folks are excluded and they'll still be on the streets because if they use substances. So using opioid dollars to help the homeless population is problematic if they are users, because then they'll still be on the street. So we have to preserve, we need a respite for our homeless current active users. So honestly, it's vigilance. It's watching the budget at your county or your city. Things slip in and slip out. Nobody knows, and nobody knows the impact until it impacts. And then you have another year of loss of change, loss of time to change and get those monies where they should have been.
I also find a helpful tactic for us is to make sure you inform your legislators or your council people that you are very aware of either what's being done or what isn't being done, and that you are going to be actively, I mean, this is something we do with our Not One More campaign, actively informing their constituents. You will be educating their constituents. A lot of these people want to remain in the seats that they have. And so when we begin to educate constituents and bring them into the work, then their ears really perk up and things can change.
And
How
one
do you-
final
how
thing
do you-
along those lines,
I'm
just I just wanted to say, consider working with your local reporters, people who are considering covering this or want to, or get them interested in wanting to cover it.
I'll second that. Every piece of progress we've made has been through our local reporters and NERI.
Thanks. There's another question about how do we find more information about how the local governments are spending the resources. And Mary, can you tackle that?
Sure. I think the resources slide that Elizabeth had, which when this is emailed out to everyone should have access to that, is a great place to start. I usually go to the opioid settlement guides started by Christine Minhey and Vital Strategies. You can, there's a pull down menu. You can look at your state. It'll tell you who controls which buckets of the money and who makes the final decisions on them. It links to websites where they might produce it. If there are no public records from your local county government, then it's about calling them, this is what I do as a reporter. I call the mayor's office, I call the county commissioners, I call the county treasurer. Like Susan said, I file public records requests asking for any documents that show receipt or expenditures of opioid settlement money from this time to this time. So really this resource slide is amazing, I think, from Elizabeth, and has a lot of things that will help you kind of go through how you can find more information about spending in your area.
And do not be intimidated by it. Like once you get into these websites, they're really well done. You will find it will go down to your town in reporting once you get in there, if that's what you want to do, if your town reported. Yeah. They're great resources. We use these all the time for our organizing and advocacy work. Right down to then we know what we want to, who we want to talk to, what we want to talk about when we go to that particular county.
All right, I know that the producer, Greg, is going to cut us off in just a minute. So I did want to thank all of you on the panel for really giving a tremendous contribution here. And I hope it's been as useful to the people who've been listening. There's a lot of questions that didn't get answered. I'll try to respond to them or pass them on to the other people within the panel who might be able to respond to them. So thank you. Greg, is there anything else we're going to be doing here?
I just wanted to thank all of our panelists today. And if you have a question that wasn't directly addressed, please look at your chat and you will see that Dan has placed his email address in there. Please email Dan and he will make sure that the questions get answered or they get forwarded to the appropriate person. Once again, thank you to everyone for joining this very important webinar covering this very important topic. And Dan, I'll throw it back to you for one final thought.
Thanks. I think we're up against tough times right now in terms of dealing with people, dealing with all the facets of the opioid crisis because of the withdrawal of funds. So this is going to hurt us with regard to prevention, treatment, harm reduction, and recovery support. And it means that we need much more advocacy at this time. And I hope that this has been useful to people who are interested in that and interested in formulating their own plans regarding advocacy. Thank you for being good listeners, and thank you again to the panel. And thanks again, Greg, to the Opioid Education Foundation of America for producing this.
Thank you, everyone. Have a good day.